Diet following lap band surgery is very important. The key functioning element of the lap band is its ability to produce satiety. That is, that the small meal satisfies both immediately and for the long term. So what we need to do is to help our patients work with the band so that they are satiated and eating relatively small amounts. Satiety is the key to success. The magic of the band is its ability to allow small meals to not only satisfy in the short term, but the long term. We need to use diet and adjustments to facilitate the band in this way. We need to therefore listen to our patients and hear what they've got to say about their eating behaviours. We need to put highly satiating foods such as protein and low GI foods into their diet before times of hunger. We want to preempt hunger in these patients. So we like them to learn to use their band as their best friend. This is not an easy concept always. It takes time to develop. They have eating behaviours which are not generally compatible with the band, and they have to learn to make some changes. They'll often tell us that they take a challenge. They talk about what they can get away with the band. You know, I can always beat the band. High-calorie liquids go down very well. Now, we know these are true, but if you want to get the best out of your band, you won't test these situations. So we need to work with our patients to better understand how the band can be used to obtain the best effect. The period immediately following the band placement is a period where the patient needs to stay on a liquid diet. The liquid diet is continued for 10 days to 2 weeks and is gradually transferred over to a pureed or soft food diet for a further 10 days to 2 weeks. And then the patient will be on a normal, solid food, certainly by the time that the first adjustment is necessary. It's important that the patient, at the time of the first adjustment, is getting hungry and is eating a fairly normal diet. There are some foods that they have difficulty with: bread, sticky rice, red meat and dry chicken. These should be avoided in the early months with a band. People should be able to eat quality foods such as fruit, vegetables and fish. Moist chicken and high protein foods such as this are usually fine. Bread is difficult and should be avoided altogether in the first months after band placement. At the time of the first adjustment, it is important that the patient needs an adjustment, and therefore they should be hungry, looking for food, concerned about putting weight on. Good eating after lap band surgery is important, and it should be emphasised to all patients at every visit. When eating fewer calories, far fewer calories in a day, there's no room for empty calories. Therefore, the patient needs to eat nutritious food. It should be a low-fat diet, and I'll explain the reason for this later. It should contain seafood and food of plant origin, high-quality proteins, such as seafood, egg, low-fat dairy and lean meats. There should be plenty of fruit and vegetables, low GI foods, that is low glycemic index foods, and the diet needs to be adequate in fibre. It's important that there's no room for empty calories, so there's no need or room for a high-fat diet. Empty diets such as high-sugar diets, high-starch diets, processed and takeaway foods, and we need to be careful that we avoid snacking and grazing. I suggest that patients have between 2 and 3 meals a day. Now, the reason why we sometimes advise only 2 meals a day is that breakfast can be difficult in patients with a lap band. So in these circumstances, when they find that they're unduly tight with breakfast, I suggest that they avoid breakfast, have a drink early in the morning, and later in the day, maybe 10:30, 11 o'clock, once they get to work, they can then have their breakfast. I would prefer them to have a cereal or toast or a high-protein breakfast rather than start to snack on cakes, biscuits and other morning tea type items. It's important to try and avoid snacking between meals. However, I think there's no problem with a healthy snack, a planned snack, and a planned snack should be taken over a defined time. What do I mean by a healthy snack? I think fruit is incredibly good, so a piece of fruit that might be available, some nuts or a small amount of yogurt. These are the sort of things that can be planned in advance, and once, if hunger is developing between meals, then they can be used over a very short period of time, not a grazing snack, but a short snack, maybe over 5 and a maximum of 10 minutes. We want to avoid high-calorie containing liquids. Liquids slide through a band very easily. Liquids in our modern society contain a lot of calories, and it's important not to consume large volumes of these. Sodas, for instance, have been shown to be, of course, high in sugar content, but also lead to weight gain. So we should not confuse thirst with hunger, and we should advise our patients to have low-calorie drinks. A patient needs to understand that they can't swallow large amounts of food quickly with a band, so they need to chew thoroughly, they need to eat slowly and listen to satiety signals. Those satiety signals will tell them or advise them that they're not hungry and that they can stop eating. Unfortunately, some people will take their eyes will do the eating for them, and they will take a normal meal and go on eating that meal over a long period of time. I think that meals should be limited in their time. Once food becomes cold, the patient should stop. It's usually appropriate to complete a meal in a period of 15 to 20 minutes. Sometimes patients set themselves up with a meal